Good morning. So today we're gonna be doing some bed mobility with our patient here, and right after we're gonna move the patient into some mobility aids using crutches. So that's what we're gonna be demonstrating this morning. So I already sanitized my hands, and I'm gonna introduce myself. Good morning, Ms. Diaz. How are you doing today?
I'm good. How are you?
My name is Pedro Hernandez, and I'll be the attending technician this morning. First, can I have your full name and date of birth?
Milana Francesca Diaz, 9/15/1983.
And why are we seeing you today?
I had a car accident and I fractured my right femur.
All right, so I read on your initial evaluation that you had a right femur open reduction and internal fixation, so you have some screws and some nails on your femur. Is that correct?
Yes.
All right. Is there anything that can prevent you from moving, kind of going and moving into the wheelchair today? All right. From a 0 to 10, how will you rate your pain this morning?
About a 4 or 5.
About a 4. Is it 4 or 5 or halfway there? Or is 4?
Like 4.5.
All right. It sounds better with 4.
Okay.
All right. Perfect. So what we're gonna be doing today, I'm gonna bring you to a sideline position, and then from sideline we're gonna sit, and then from sitting position I'm gonna be doing some perturbations and kind of testing the grip of your hands, and then from there I'm gonna move you to the wheelchair, and I will show you how to ambulate from the wheelchair to the crutches, and then we're just gonna walk a few feet, and that'll be it for today.
Okay.
Are we good with that?
Yes.
All right, so what I'm gonna do, since your right side is your affected side, is it okay if I touch your leg?
Yes.
Because I'm gonna bring it, can I flex it? Flex your knee?
Yeah.
A little bit? All right, so what I'm gonna do, I'm gonna slightly flex your right knee. All right. And it is non-weight bearing at this point, so once I move you to your side, and once we're ready to sit, I don't want you to help me out. Good to go?
Okay.
All right, so can I have this arm like this, right? And this arm, can you bring it across your chest? Can I try to hug yourself? And I'm gonna bring my left hand and I right around your hips. This one will be right around your scapula.
Okay.
Are we good?
Yes.
All right, so before we roll you to your side, I'm gonna say 1, 2, 3, roll. Once I say roll, then I'm gonna roll you.
Okay.
Good to go? All right, first, gonna have you just scoop a little bit closer to me. Perfect, without putting any weight, that's good. All right. Are you ready?
Yes.
All right, so like I said, 1, 2, 3, and then we roll, all right? All right, so 1, 2, 3, roll. All right, how you doing?
Okay.
Dizzy?
No.
No? All right, perfect. So now I'm gonna slightly flex your knees a little bit. That's good. I'm gonna bring this hand and I'm gonna grasp your knees. Good to go?
Yes.
All right, this hand I'm gonna bring it kind of like around your neck, and then I'm gonna focus on your scapula. Good? If you can help me with your left hand as I'm bringing you to a sitting position, help me out. So you're gonna kind of push with that hand.
Okay.
Good to go? All right, same as we did for the sideline. So 1, 2, 3, sit, and then we sit. Good?
Okay.
All right, so 1, 2, 3, sit. All right, how you doing?
Good.
Any dizziness?
No.
Light headache?
No.
All right, so I'm gonna place this gait belt around your waist.
Okay.
Are you good?
Yes.
Hands up, please. And this gate belt is just for safety, right? Since we're gonna move you and we're gonna start ambulating a little bit. How's that?
It's good.
It's not too tight? Good? All right, so I'm gonna test your core stability. I'm gonna do some perturbations. Don't let me push you, right?
Okay.
Right, so to the back, now side to side. Good?
Mhm.
All right. Can you switch my fingers? Good?
Mhm.
All right. All right, so now I'm gonna bring you down. Make sure that once you bring the patient all the way down to the floor, that his or her feet are in contact with the floor, like flat foot. That's one. Second thing, once you bring the patient down, make sure, in this case she has boots on, but make sure that the patient has either non-slip socks or shoes on before you start ambulating that patient. All right, so like I explained to you before, now we're coming from the sitting position and we're gonna transfer you into the wheelchair. First of all, we're gonna wanna make sure that the wheelchair is completely locked. All right, so the way we're gonna do it, can I have you scoop a little bit closer? That's one thing. Make sure that you don't put any weight on that affected side. So always keep in mind the weight-bearing status of the patient. As we transfer you to a wheelchair, I'm gonna help you stand up. I'll ask you if you feel dizziness or any lightheaded, right? And then to transfer into a wheelchair, all I want you to do is just pivot. I don't want you to start hopping. Good? Then just like we did for the transfer to your side and sit up. We're gonna say 1, 2, 3, stand. We're gonna pivot to the wheelchair, and then I will say 1, 2, 3, sit, and then you're gonna start reaching out to the handrest of the wheelchair, and then we're gonna sit. Good? All right. One last thing before we continue, right? Don't hug me. Don't allow your patient to bring his hand into your shoulders. Good? Ready? 1, 2, 3, stand. Pivot. Pivot. 1, reach out. 1, 2, 3, sit. How you feeling?
Good.
Before you start ambulating your patient, remember to lock your wheelchair on both sides. Right, so now as I explained to you before, we're gonna transfer you from the wheelchair to stand-up position using the crutches, and then I'm gonna show you how to properly use the crutches and ambulate. Just walk a little bit, right? About 10 feet, and then we're gonna come back to the wheelchair. So in your case, your right side is the affected side, so weight-bearing status is what?
Non-weight bearing.
Non-weight bearing, right? So we want no weight on that leg. Always remind your patient of that weight-bearing status. So we're gonna bring the crutches to the strong side, which is gonna be your left side. Both of them will be on the unaffected side. You're gonna place your hands on both crutches, right? With the affected side, right? Always remember that unaffected side will be non-weight bearing. You're gonna place your hand down. I'm gonna help you stand up as well, using the gate bill. Good? Right, as we stand up, you're gonna push through the crutches and then on that affected side arm. Good to go? And then I will say 1, 2, 3, stand. And then we stand. Once we stand, I'm gonna help you bring one crutch to the other side. Always remind the weight bearing status. And then from there, we're gonna ambulate. Good to go? But before we start ambulating, I'm gonna show you the gate that we're gonna be using today, which is the 3-point gate, non-weight bearing. So for the 3-point gate, that right side is gonna be your affected side. You're gonna bring both crutches at the same time with that leg. So pretty much picture as if you were to have that right leg attached to that right crutch, right? So you move both crutches and that leg. Good? Any questions with the gate?
No.
All right. As I said, this would be on your unaffected side. This hand will be right there. Don't forget the weight bearing status, good? Let's go a little bit closer to the edge. Perfect. 1, 2, 3, stand. And then we stand. All right, ready?
Yes.
Feeling good?
Yes.
All right, so 1, 2, 3, stand. All right, how you doing?
Good.
Perfect. So now, get 1 crutches. How you feel?
Good.
Perfect. Walk a little bit closer, like I said. You bring, there you go. And you always want to stand on the affected side as you ambulate your patient down. Go ahead. Once you turn, you're gonna turn to your unaffected side, which is your left side. So you're gonna U-turn. Perfect. Awesome. How you doing?
I'm good.
Perfect. All right. Again, you're gonna turn to your unaffected side. All right, just like we did before, right? So now we're gonna pass this one to your unaffected side. Always keep positive contact on that gate belt. Perfect. Once you put, doing good?
I'm good.
Perfect, all right. Are you feeling dizzy?
No, I'm good.
All right, can you feel the wheelchair behind your knee?
Yes.
All right, so perfect, reach back, and then just like we did before, 1, 2, 3, sit.
Okay.
All right, 1, 2, 3, sit. Awesome, how you doing?
Good.
Perfect. How was the session today?
It was good.
Any pain?
No.
Compared to the beginning, no increased pain?
No.
Awesome, perfect. Do you have any questions for me?
No. Oh, wait. I'm gonna keep these, right?
Yes, these are yours, so you're gonna keep it.
Okay.
Any other questions?
No.
All right, so you did perfect today, and I will see you in 2 days.
Okay. Thank you.
And I'm gonna gel out.